Senator, whenever you're ready.
Great, awesome. Well, thank you everyone for joining this really important discussion today. And let me start by expressing my deep appreciation to Erin and Penny and Tzena and Julie, who took the time to be with us today. I am so grateful for your service, and I'm really looking forward to hearing about the ways I can keep fighting for you in the other Washington, because as meaningful as today is, recognizing and honoring our nation's veterans is not a one-day thing, not at all. As I have often said, our country makes a promise to our veterans that after your service ends, we will take care of you and your family when you come home. I am the daughter of a World War II veteran and a Purple Heart recipient, and I'm former chair of the Senate Veterans Affairs Committee. So I know firsthand how important it is we honor that promise. Yet for too many veterans in Washington state and across the country, the VA and other federal agencies are not doing enough. And this is especially true for women, who are the fastest growing group of veterans. I hear way too often about veterans facing problems when they return home. Some struggle to find work and can't make ends meet. Others find this wall of red tape between them and the benefits like health coverage and mental health care that are supposed to be part of the deal. And so I will always stay focused on these issues until they're fixed. For example, for so many, the VA still won't cover reproductive care to help veterans start a family. And it's because of conversations like this one that some major pieces I'm pushing for this year are to address issues I've been hearing from women veterans. And that includes working to make sure the VA expands fertility treatment, counseling, and adoption services for veterans and their families through my Veterans Families Health Services Act. That VA prioritizes the long-term care needs of all veterans, especially women veterans, so they can find the services and facilities that work for them, and treats military and veteran sexual assault like the crisis it is by improving their military sexual trauma claims processing so survivors can access their benefits. And in our Build Back Better Act, I'm pushing to make sure everyone, including our veterans, is able to keep a roof over their heads without breaking the bank, get the skills and education they need for a good paying job, and access quality, affordable childcare, and much more. My proposal to finally make childcare affordable and accessible for families, or the expanded child tax credit to give families some breathing room to afford the essentials, is part of this as well. These proposals will help everyone in Washington state, but we know how much more acutely many of these challenges are felt by women veterans who are returning home, working so hard to make that transition back to civilian life after sacrificing so much for our country. So I'm pushing very hard to make some really critical changes and investments this Congress. But I also want to briefly note some of the recent progress we have made to improve VA for women, including the permanent authorization of the child care pilot program to increase access to free quality childcare for veterans during their appointments, making much needed improvements to the Women Veterans Call Center. And we fixed a loophole that left veterans footing the bill for medically necessary emergency newborn transportation that VA should be covering. I mean, think about it. The VA was sending the veteran a bill after they had to take an emergency trip to the hospital for their newborn. It was absolutely unacceptable, and we fixed it. Look, if we're going to get our women veterans the help they need and deserve, then we have to make sure the VA offers the specific services and support women veterans need and welcomes them home. So the VA is there for women too. I'm always talking with Washington state veterans because conversations like the one we're having today help me know what veterans need me to get done for them in the other Washington. And look, I'm confident we're going to get a lot done this Congress that will make a difference for our veterans and especially women. And while these changes won't be seen overnight and we won't fix every problem women veterans face, They are happening because of the tireless advocacy from veterans on issues affecting them and the personal stories like we will hear today. So I'm really looking forward to hearing from each of our guests today. And I really appreciate everyone taking the time to share their thoughts and perspectives with us. With that, I'm going to turn it over to Erin.
Senator Murray, I want to thank you. I hear and appreciate the great work that you're doing and definitely support it. As a woman veteran, so a little bit about me. I am a Coast Guard veteran, born and raised here in the state of Washington. I spent the first 30 years of my life in Western Washington, right there along the I-5 corridor, really convenient to a lot of critical VA services, whether it's American Lake or the hospital in Seattle. And a little over 5 years ago, I moved to very rural Southeast Washington in Kennewick. I live in Kennewick, Washington, and I do a lot of work across Benton and Franklin counties. And one thing that I hear from women veterans in this region is there's concerns about access to and level of care when we're going to either seek medical care because we choose to use the VA as our primary healthcare provider, or we're working out kinks with our claims and trying to get things reviewed and resolved. I've heard concerns about appointments being canceled on veterans. And if that's your primary health care, it's hard to get your primary health addressed if your appointments are being canceled on you. The other issue that I hear is there tends to be a hyper focus on service-connected issues. And so when a veteran goes to their provider and says, I'm having this issue, it might get brushed off or be less important or feels that way to the veteran anyways. I know women who have been straight up told that they wouldn't have the issue addressed that they came to have addressed because that's not what is on the order for the doctor to review. And that's concerning and frustrating and discouraging when it comes to the claims process. And addressing needs. Again, I think that a lot of what I heard when you were sharing earlier was talking about the woman veteran as a mother. I think that we need to look at the woman veteran as a professional, as the breadwinner, as the person who is potentially single. I happen to know a lot of single women veterans, and they're working to maintain that roof over their head. And when they get a referral to the Seattle area, that means taking off more than a day for work, maybe 2 days, because they've got to get themselves to Western Washington for that specialty, and then they've got to get them back. Or even more locally, I don't even think that we have a vet center closer to us than Yakima or Spokane. Yakima is still an hour and a half away, and Spokane is closer to 2.5 hours. So then I would strongly ask that you do what you can to advocate for mental health services, not only for women veterans, but everyone. We need more. I don't know if that's changing education requirements for those professionals or licensing requirements. There's a lot of work, and I know it's not all on your shoulders, but I know that the services in the mental health, when it comes to VA health benefits, it just feels like they're so far away when you live in Southeast Washington, in short. Let me see. Also, I think that I can speak for quite a few veterans when it comes to oversight for veteran service organizations, whether they're state or nonprofit organizations. There's a lot of organizations out there that say that they're there to help veterans. And as someone who's dabbled in a lot of them over the last 5 years, there's a lot of time wasted, in my opinion. And I think in the opinion of others that there's organizations that say they want to help the veteran, but we're not exactly sure how they're helping the veteran. I don't know what kind of monitoring or such can be put in place to help keep better tabs on that, but that's something I would like to see. I think with that, I'm not monitoring my time. I apologize. I will pass it over to Penny.
Good afternoon, everyone. Thank you again for having us. I think this is super important. little bit about myself. I served 4.5 years in the Army Reserve and then served 20 years in the Army. Came back to very rural Washington, Whitman County. The really only active veterans organization we have here is the American Legion. And we are 80 miles from Spokane. And that is a huge obstacle for veterans of all ages out here. We have over 2,300 veterans in Whitman County. And we have to travel 80 miles and miss a day of work or find transportation or miss a day of school to get to Spokane for our appointments. Lewiston is 35 minutes to the south, but they fall under Walla Walla. And there's the obstacles again with the records. And we all know that there are issues with the new records management system. I wanted to echo a little bit about what Erin said. Mental health is a huge issue and a huge obstacle. We are seriously lacking mental health providers. I can use myself as an example. I've been trying for 3 years to get into a mental health provider. And a lot of places don't want to take TRICARE. I've moved to VA community care, but there are obstacles there as well. It's very frustrating. You have to still wait for the referral process. Then you have to find a provider that will take it. And then you're put on a wait list with that provider to even get assessed to even start your care. It is demoralizing. It is frustrating. And that's why a lot of our veterans give up. They're tired. They give up. They don't feel cared for. And I work with a lot of students. And the same thing with the students. They're frustrated because they're trying to use local services so that they don't miss a day of school to go all the way up to Spokane for an appointment. I think our rural areas are seriously lacking in the need for additional clinics or service providers to be more localized. I honestly, in my personal view, I don't think a veteran should have to travel more than 50 miles for their care. Anything outside that 50 miles, they're losing an entire day of wherever they're coming from with travel, wait time, appointment, and then travel back. I also wanted to mention that women veterans are unique in that obviously we have different physiological needs, but generationally, we're very different. I can see the need for the younger women veterans wanting things like IVF and needs for daycare. The older generation women veterans have totally different needs, even though we've had the same exposures. You know, the exposures to the chemicals and the burn pits and things like that. Our needs are different. We're past the IVF stage or the daycare stage, but we still have needs that need to be met. Let's see. I want to talk a little bit about community care. I've already mentioned it. When I was preparing for this, speaking with your staff, I kind of used a phrase similar to community care is kind of a cheap way of the VA getting out of taking care of veterans in the rural areas, and because of those obstacles. And if community care is going to be the way that we go, we really need to streamline it so that it's not a 30-day wait for a referral and then another 3 weeks wait for an appointment and that sort of thing. Again, people just become demoralized and frustrated and just throw their hands in the air and say, screw it, I'm done, you know, sort of thing. I work with veterans of all ages. I'm also a county volunteer officer for our Whitman County Emergency Relief Fund. So I work with elderly veterans who are on very, very limited incomes. And, you know, we are also in one of the most food insecure counties in the state. And income is a huge issue here. So the lack of care and resources in our area, compounded by low incomes, it just compounds. It's a vicious circle. So that was my primary points. I think I hit. Let's see. I'm sticking to my notes here. And I cannot emphasize enough the lack of mental health care. That is just a huge issue. And if the VA can do some sort of incentives or I don't know. I don't know what the answer is. I guess that's what you folks are for. Incentives is the only thing I can think of. Knowing some of the counselors in the area, we have some great folks that want to work with veterans, but they're just overwhelmed with patients. They just can't afford to take on any more patients as much as they want to. Thank you for the time.
Me. Hello.
All right, and we'll turn it over to Tzena Scarborough.
Hello. Good afternoon, Senator, and all those people here. I grew up in Okanagan, Washington. After high school, I joined the Women's Army Corps in 1976. The Army had recently opened up new jobs to women, and I was one of the first women to work on Cobra helicopter electronic weapon systems. My job was to make sure the missile went where it was supposed to. My first duty station was in Hanau, West Germany during the Cold War. I was the only woman in a platoon of 40 men. Our job was to defend against the Russians that would come across the Fulda Gap 50 miles east of our location. After 3 years, I re-enlisted and went to Fort Eustis, Virginia, where I wrote soldiers' manuals, and I was the only woman again out of 80 men. I was promoted to the rank of Sergeant E5. I was then sent to Mainz, Germany, Mainz, West Germany, where I was the highest ranking female on the base of about 2,000 troops. When I told troops to do something in my platoon, they wouldn't do it. I would go to my supervisors and they didn't support me. I wore the rank of sergeant. It should not be anything about my gender. In recent years, becoming older and wiser than I was at 25 years old, I realized, and somebody told me this, that this is kind of funny, but it's not. It's most men don't listen to women. I had a counselor, a doctor years later say, didn't you know, Tzena, that most men don't listen to women? But in the 70s and 80s, it was hard being a pioneer during that time, I guess, to be expected. You guys, I'm telling you to clean your room and you didn't clean your room. So anyway, it was hard being not taken serious, and it was kind of a hostile work environment. They wouldn't respect my rank. They didn't give me my own room. I mean, just different things about that during that pioneer time. In the 80s, it wasn't popular to be a veteran after I got out in 1983 from Germany. Having served with lots of Vietnam veterans and some of the struggles they had then, we didn't know what PTSD was. I didn't identify as a veteran. When I looked on Veterans Day and Memorial Day, I saw faces of men, Iwo Jima, rice paddies, and combat pictures. So that's not me, but I served 7.5 years of my life. It took me time to become comfortable even going to the VA because I felt disconnected from other veterans. I felt invisible. But I did get connected in 1986 with the Spokane VA, and I've had great care since then. Of course, there's been a few bumps in the road. Like I've been called Mr. sometimes because they don't know how to say my name, or they don't know, or they assume I'm a guy. But I've worked through that. On Penny's note about community care, that has been one of the biggest for the last 3, 4, 5 years with all the different names they've called it. When years ago, the VA hospital, oh, Tzena, you need a mammogram. Okay, we have a contract with a mammogram place. You go out there, you do it, you come back. And with I can't remember what it was 3 or 4 years ago that came out to go out in the community. The VA employees used to manage all of that. Then TriWest, I guess that's what it was, TriWest and all those things. That comes in and you have uninformed people of the system in Spokane, and knowing who, what, where is there. You have to say, well, what doctor you want to go to? I don't know. I've got my VA care is everything I get. So anyway, and they're my primary care since 1986. By the 1990s, I was working at a veterans event wearing an Army hat, and someone came up to me and thanked me for my service. It was the affirmation that somebody finally recognized me. It was the first time I'd been recognized as a veteran. In 2012, I joined the American Legion here in Spokane, Washington, and I serve as a service officer, and I help other veterans get the benefits and the care that they have earned. I am also the youngest in the whole post, and I'm the only active woman veteran in the post. I have a business card that says, when I see someone at the Costco or a military hat or veteran, I'll say, are you getting all your benefits? And they go, I don't know. And I say, well, here's my card. you may be eligible for veterans benefits or cemetery or whatever. And I give them a card and it says, I can tell you where to go to get services. I also have a business that I teach senior citizens how to use their computers, and that's all because of the Army. I learned basic electronics. And so a lot of my seniors are veterans themselves, or they are spouses. So I get the opportunity to serve with some of the greatest generation and hear their stories, but also help them get benefits and burial benefits. One gentleman was on the in an urn on the mantle, and so I helped the widow get him buried. I'm also on the Eastern Washington Veterans Task Force, which is 260 organizations in the Spokane area helping veterans, everything from fly tying to SSBS and all those things. I'm also representing the Eastern Washington, I'm on the Women Veterans Advisory Committee for the State Department of Veterans Affairs, representing Eastern Washington. I think my main focus in closing would be is helping veterans to get through the system. It took me a long time in the 80s. Nobody helped me with my claim. No, I mean, the service officer did, but I didn't know what to do after that. So I said, when I get my claim, I'm going to help other people. So everywhere I go, I talk to somebody every other day at least and give them my card and tell them where they can go to the hospital or whatever to get benefits. The other thing is to change what the face of a veteran looks like. Change what it looks like. We need to educate the military and the community. We all need to reach out to one another in service organizations or in our community. There's a campaign called I Am Not Invisible, started by the Oregon Department of Veterans Affairs. I'm not sure if you've heard of that, Senator. When you're in the military as a woman, you are very visible. When you get out of the military, you're very invisible. And I'm on a lot of Facebook pages with women veterans. I've never had this experience, but one example would be when you go to Home Depot and park in the veteran spot. I had a lady say she got out of her truck, she parked there, and this guy yelled at her, "That's for veterans." And she said, "I'm a veteran." And so, I mean, we always have ignorant people, but we have to educate them and say, we serve too. So if the face of veterans changes to women, women are included too, that I think that would be really great. So in closing, I'd like to say that we need to educate the military and our citizens that women are veterans too. We women have always volunteered for years and years and years. Thank you. Now I'd like to introduce Julie Liss, who is the Women Veterans Coordinator at the hospital, and I'm glad to know her too. Thank you.
Thanks, Tzena. I just want to echo Penny and Erin and Tzena's comments. Specifically in regards to the I'm Not Invisible campaign, which we have some posters coming specifically to help the increase of visibility of women veterans who have served. We obviously have lots of challenges, and your discussion about mental health services, I kept nodding my head. I think in light of COVID, it's really brought to light an increase in virtual visits, but it's also brought to light that I really like your idea about incentives. About incentives to providers to provide mental health care, because our reimbursement rates are not the greatest. I think that would be an important way to go about expanding those services. So I just wanted to echo that. Personally, as a woman veteran, I served about 11 years active duty in the Navy. The remaining time was in the reserves. My brother is a combat veteran and just got out about a month ago. A large family history of serving. Specifically in regards to my role as the Women Veterans Program Manager at the Spokane VA, I have enjoyed the blessing of seeing this tremendous expansion of healthcare services and resources. And sometimes when I have opportunities like this to talk to you, Senator, and share with perhaps other folks, it kind of just reminds me how far we've come, and yet there's still lots of challenges moving forward. Specifically, I wanted to kind of mention our expansion of our whole health initiatives that include yoga, massage, chiropractic. We have a GYN provider half-time at the facility. Of course, our facility director is a GYN provider. We have a maternity care coordinator that's creating a very holistic program that includes yoga for expectant moms and partnering with our dietitians. I'm very excited. We received some grant money and we're standing up a pelvic floor physical therapy program. My personal way that I practice as a nurse has been that we need to be thinking about serving families and serving both men and women veterans. My husband is a Marine Corps veteran, so the opportunities to really expand these services and really look at how we can serve these families. We have the largest amount of designated women's healthcare providers that we've ever had that are trained to be interested and proficient in providing comprehensive primary care to women at our facility. We have 7 right now, and we have 2 at each of our CBOCs and our rural partnership clinics, which is really exciting to me because it increases the visibility, it increases the access for women veterans, and it just gets more of that information out there. Because when I first started in this role, it wasn't uncommon for women veterans to tell me these stories about how they were turned away or they were told that those resources just weren't available. We didn't come here to take care of women. Just stories that just frankly made me quite angry. So I'm very proud to say that our leadership has been very supportive at our facility about looking at things and how can we expand these services within primary care, our executive leadership. So I'm very excited about that. And with the recent passing of the Deborah Sampson Act, the expanded eligibility for MST care is really exciting. And also we have had our first VISN town hall that we did as a VISN as a region that was very successful. And we do have a women's focus group that's coming up November 30th at 5 p.m. So if anyone is interested in participating in that, I welcome that. And the opportunity is really to discuss perhaps gaps, talk about services, and kind of expand that. And I think in a highly rural healthcare setting such as ours, which is over 66,000 square miles, it's really important because we haven't been able to go out and outreach as, that's really our love, is to go out and meet veterans where they are and build those relationships of trust that say, no, we have these services. And I could tell many stories, but you don't want to listen to me ramble on and on. Senator, I do want to mention, we were early adopters of the legislation that you have to support, specifically surrounding in vitro fertilization. And I quickly, there was quite a learning curve. Not that I'm a shy person, I'm an old labor and delivery nurse, but I quickly learned about the stories of these men and women who had spent thousands and thousands of dollars who couldn't otherwise naturally create children, and their sense of urgency. So we have been successful in many of those areas with couples and their non-veteran spouse and getting those resources available to them through our partnership with Seattle Reproductive Medicine and University of Washington. But I'd really like to see some expansion of those services to mirror more of our regular infertility benefits, and perhaps to cover surrogacy for women veterans who have a service connection who can't otherwise carry a child. You mentioned about adoption benefits. I'm really excited to hear about that. Pardon me, and I'd really like to see the expansion into same-sex couples as well, because we have a number of folks that resource is not available to them. Also, perhaps some changes in the number of cycles of IVF. It's really limited. The numbers of times, in IUI is 6 times per pregnancy. IVF, it's 6 times max. And we can discuss offline some of these things because there's a huge learning curve. I've learned so much. Also, in regards to the transportation for cryopreservation, we currently have a couple that actually is from Hawaii, but are getting their services here, and they don't want to transport what they've already created to go to Hawaii, and the VA doesn't cover that. And we've also had a couple that moved to New York who, VA doesn't cover that transportation. So it's kind of an interesting gap in that particular area of their in vitro fertilization coverage. Finally, I just want to say I'm really open to any suggestions that anyone who is on this call that has ideas about expansion of women's healthcare services. And I just feel incredibly blessed in the job that I'm in as I've seen women's health kind of evolve. So thank you.
Thank you so much, Julie. And we are hitting the 30-minute mark, but we want to give reporters just a quick opportunity for any questions. So if you do have any questions to the reporters on the call, I would just go ahead and unmute in the interest of time. Feel free to turn your video on and address your question to either the senator or any of our participants. All right, going to do one last call for questions. If anyone stepped away from their computers. Okay, great. Seeing none, and since we're right at time, I will turn it over to the senator for closing thoughts.
All right, well, thank you. Thank you to everyone for sharing your thoughts. And I heard you, mental health is such a critical issue for everyone, but certainly it is for many of our service members, and we've got to really focus on that. So I appreciate those comments. Obviously, more and more women are veterans today, and I agree, we have to recognize women veterans, ask women veterans, so that women come home and get the services and support that we have promised. And too often that doesn't happen. I talk to too many women who say, I don't know if I'm a veteran, and they served our country. So we need to really step up outside all of this and recognize women veterans today and every day and make sure we are there for them. And finally, I just want to keep working with all of you to address the many issues you talked about so that all of our veterans recognize that we are here for them every day to make sure they get what we promised them when they served for all of us. So thank you so much for this great conversation. Look forward to continuing to work with all of you. Thank you.
All right, that concludes today's press call. It was recorded and will be distributed widely. If you have any questions you didn't get to ask, you know where to find us. Thank you.
Thank you all.